And this morning we're wrapping up our Hair Today, Gone Tomorrow series. Some people say bald is beautiful, but if you're not one of them, how can you deal with your receding hairline without going under the knife? Dr. Craig Ziering is a dermatologist who specializes in hair loss. Doctor, good morning.
Good morning.
Good to see you. We should mention a lot of guys are losing their hair, but they don't do anything about it because they're in denial. You see that all the time, don't you?
Yes, there's basically three things. They're in denial. They just feel that their hair loss isn't really that bad. They're also fearful that there's nothing out there that will really work for them.
Let's talk about medications. Okay, the FDA has approved two medications. One is called Propecia. First of all, tell me how it works and how effective it is.
Okay. Propecia is a pill that you take once a day, and it blocks the conversion of testosterone, the hormone, to DHT. DHT is that bad actor that miniaturizes and makes the hair follicles small and stop growing. And what it does is it stops that.
All right, because we're looking at pictures before and then after 5 years. So what you're telling me, and by the way, dermatologists have said there's about a 90% effectiveness rate for Propecia, but what we're seeing here is it doesn't give you a rich, luxuriant head of hair. It stops the loss and maybe gives you a little bit more.
That's correct. 9 out of 10 patients will say that it either freeze frames where they're at, and since hair loss is progressive, that's a good thing, and we can use it in conjunction with hair transplants, or it will give them some actual growth.
It costs about $50 a month for these pills, not to be used by women.
Correct.
Right? Especially if they're going to become pregnant.
Correct.
And what are the possible side effects?
The side effects are rare and they're reversible, but less than 2% have a decreased sex drive.
Okay, but you do say they are reversible.
Absolutely 100% reversible.
Rogaine with minoxidil is a topical solution. How does it work? Does it work? And what are the side effects of it?
Yes, Rogaine is an FDA-approved medication that is over-the-counter now, and that's used and safe for men and women. So we use that at Ziering Medical for both of them. And it works by reversing that miniaturization process, and you just apply it topically twice a day.
All right, we're looking at before and after 16 weeks, so 4 months on this one, which is a pretty good result there. Side effects from Rogaine?
About 6% of people have some skin irritation.
And what happens if you stop using Rogaine or taking Propecia?
You want to continue to use both of them, and you actually need to use them at least a year to make sure that it's going to work for you.
All right. Now, let's talk about toupees and hairpieces. They have long been a staple of slapstick comedy, but those in the industry say their products have evolved. Take a look at one man who opted for a hair system, and we'll talk to him on the other side of this tape. Jim Curcio looked in the mirror and says he didn't like what he saw.
I looked old, but I didn't feel old.
So he went to Hair Club for what's called a biomatrix, or hair system.
What we're going to do today is measure just for a frontal, and we're going to work with your existing hair.
It will be attached to his own hair using an adhesive.
We're just going to check different color samples.
During his consultation with a stylist, a new look is mapped out.
This is just going to be a partial. We're going to work with your existing hair here. This will give you a very natural hairline.
With measurements in place, the information is sent to China, where human hair is applied to a fine lace matrix that's made to order. About 3 weeks later, Jim is ready for his application and a new head of hair.
It's perfect.
Jim Curcio, good morning, and
Good
wow,
morning.
you look great. Are you thrilled with this?
Oh, absolutely. I'm so glad I did this.
This is attached to your scalp with adhesive. How does it feel?
You don't even know it's on your head.
So you don't feel it like a weight that's going to tip to one side or another?
No.
What happens when you wake up in the morning?
It's like having your own head of hair.
You comb it. Can you wash it?
Wash it normally, condition it, comb it any way you want.
Now, I understand there's an initial payment for these systems somewhere around the $1,200 range, and then there's a maintenance fee. What happens during the maintenance process when you go back?
Well, they remove it, clean it up, cut your hair, and then reapply it.
What kind of reaction have you gotten since you've done this?
Oh, people are telling me I look 10 years younger. It's wonderful. Some people have said, you shaved your mustache. I haven't had a mustache in 10 years. So, you know, it's pretty interesting just watching all the reactions.
You started losing your hair when you were in your mid-20s or late 20s?
Late 20s, early 30s.
Technology has now changed a lot, but are you sorry you didn't try something like this a lot earlier?
Now, yes. I wish I had done something sooner.
And now that you've got the hair system, would you ever consider any of the surgical options, the permanent options?
Yeah, the reason I chose the replacement, the hair system, was because it wasn't permanent. And if I didn't like it, I can, go back the way I was. But I'm certainly considering doing surgery.
The amazing thing, doctor, is just shows how this industry has come along. What's on the horizon?
Yeah, we've come a long way. On the horizon are some exciting things. Some are dealing with light and lasers, and they're not FDA approved yet, but if it's going to be beneficial to our patients, we're very excited about that. And then cloning, where we'll actually be able to take hair from the back of the head and during a transplant procedure send them to a lab and get them cultured and actually inject into the scalp these seedlings or reproduce more hair follicles, and that way people have unlimited donor.
The message to men, though, is if hair loss is negatively impacting your life, there are a lot of things you can do about it. Don't suffer in silence, and don't be in denial, as you said earlier.
Absolutely.
Doctor and Jim, thanks very much. Again, you look great.
Thank you.